Welcome to Greenway Automotive. The benefits we talk about today will be in effect through the end of our benefits plan year of May 31st, 2020. Greenway Automotive employees are eligible for benefits if you work 30 or more hours per week. Your benefits are effective on the first day of the month following 60 calendar days of service with Greenway Automotive. If you choose not to elect coverage during this enrollment period, you will have to wait until our next annual open enrollment to enroll. Greenway Automotive is proud to provide employees with an extensive list of benefit options. Health and welfare benefits are available to full-time employees and their dependents. Please note, if your spouse is employed and eligible for coverage through their employer, they may not elect the Greenway Automotive medical plan. Our health plans are administered by Blue Cross Blue Shield of Florida. The dental, vision, life, and disability coverages are with Guardian. We offer an employee assistance program through Guardian's Work Life Matters. Additionally, we offer voluntary accident, critical illness, and hospital indemnity coverages through Guardian. Over the next few minutes, we will discuss each plan in greater detail. All of the information provided today is available in greater detail in our benefits guide. Contact information for all of our insurance carriers and benefit consultants is also included in the guide. This guide is posted on the Plan Source online enrollment website, as well as in Complete. Be sure to review this before making your elections. You will enroll for your benefits using our online enrollment system, Plan Source. You can log in directly to the Plan Source enrollment site from any computer with your username and password using the format shown here. Your personal information will be loaded in the system, but please review and update your contact information, family member information, and life insurance beneficiaries. Plan Source will guide you through each benefit plan for you to make your elections. When you are finished, you should save or print a copy of your confirmation statement for your records. If you elect a coverage that requires evidence of insurability, you will be prompted to click on a link to complete a series of medical questions online. If you have any questions or concerns, please contact Human Resources. Refer to your benefits guide for more details. Our health plans with Blue Cross Blue Shield of Florida cover in-network preventive care at 100%. No deductible or copay applies. This includes coverage for annual physical exams, annual well woman, well man, and well child exams, lab work associated with an annual exam, flu shots, mammograms, and prostate exams, just to name a few. We encourage all employees to take advantage of this benefit and seek routine annual checkups. Early detection can lead to better outcomes. We offer 2 plan options with Blue Cross Blue Shield of Florida, so you can choose the plan that best meets the needs of you and your family. Our PPO plan has an embedded deductible. An embedded deductible means that all individual deductible amounts will count towards the family deductible, but an individual will not have to pay more than the individual deductible amount before coinsurance coverage begins. Our HSA plan has a non-embedded deductible. A non-embedded deductible means that no benefit is paid except preventive care until the total medical expenses paid by the family equals the family deductible amount. Please note that all deductibles are based on a calendar year, January 1st through December 31st. For both plans, lab work must be completed by an in-network lab. If you use an out-of-network lab, you will be billed for the full retail cost as if you did not have insurance at all. If you are not going to Quest, take time to find out which labs are in your network in your zip code. Please refer to your benefits guide for more information. Over the next few minutes, we will discuss the details of each plan option. If you elect the HSA plan, all non-preventive medical services, including prescription drugs, are subject to a $2,500 in-network calendar year per person deductible capped at $5,000 for family. After you have paid your deductible, the plan will pay 80% of covered in-network services and prescription drugs, and you will pay 20% until you meet your out-of-pocket maximum of $5,000 per person, but no more than $10,000 if you cover dependents. This plan does have out-of-network coverage, however, it is subject to a separate and higher deductible and coinsurance amounts. The PPO plan has copays for physician office visits, emergency room visits, major diagnostic testing, diagnostic lab work, hospitalization, outpatient surgery, and prescription drugs. All other medical services are subject to an annual deductible of $1,000 per person, capped at $2,000 if dependents are covered. After you meet the deductible, the plan will pay 80% of covered in-network services, and you will pay 20% until you meet the out-of-pocket maximum of $6,000 per person, but no more than $12,000 if you cover dependents. The out-of-pocket maximums include the annual deductible, co-insurance, and all co-pays. After you have met your out-of-pocket maximum, the plan will pay 100% of eligible in-network medical services for the remainder of the calendar year. Prescription drugs are categorized within tiers. Each tier is assigned a copayment, the amount you pay when you fill a prescription. Mail-order prescription drug service is also available for a 90-day supply of maintenance medications, and this setup can save you money. We encourage you to use generic prescription drugs. These drugs cost you less and help us control the cost of our health plan. It is important to research and discuss your medications with your medical providers. Shop around. Many pharmacies offer $4 generic medications and even free antibiotics. In many instances, you can obtain generic prescriptions for $4 by using the pharmacy at Walmart, Walgreens, and other retail pharmacies by not showing your health insurance card. Keep in mind, at some merchants, an extensive list of generic medications are available at no cost. Highland Script Navigator is the ultimate pharmacy search engine for discounted generic drug programs available at pharmacies throughout the U.S. Visit the website below, enter the drug name, dosage, and your zip code, and Highland Script Navigator will find the best deal for your generic prescription. You can also find therapeutic alternatives, search for a specific pharmacy, and even find pharmacies that have your prescription on their $4 generic drugs program. If you enroll in the HSA plan, you have the opportunity to open and contribute tax-free dollars to a health savings account, or HSA. Our HSA administrator is HSA Bank. A health savings account is your personal bank account. All contributions to your HSA are made on a tax-free basis. Once deposited into your account, the balance will always be yours. It cannot be forfeited, and unused funds will continue to grow year after year. Funds in the account may be used to pay for medical, dental, or vision expenses for you or your dependents. You may also purchase over-the-counter medical supplies with HSA funds. However, over-the-counter medications will require a prescription from your physician. If you enroll in our low HSA plan, Greenway Automotive will contribute $100 to your HSA account each plan year. Please take note of the maximum amount that may be deposited to your house savings account each year. You must keep receipts for expenses you pay for with your HSA, as this is an IRS auditable account. Purchases made for ineligible expenses will be subject to a tax penalty. If you are enrolled in Medicare, TRICARE, or enrolled in other coverage that is not a high-deductible health plan, you are not eligible to contribute to a health savings account. Be sure to take advantage of this opportunity to save money in your HSA. Our benefit program includes convenient online tools that should be utilized. My Health Toolkit is your one-stop shop for answers about your health care. It has everything you need to understand your health plan coverage and manage your benefits. By registering online at www.myhealthtoolkitfl.com, you will have access to your processed claims and explanation of benefits. View the status of a claim, find a network doctor or facility, compare treatment costs, and more. If you enroll in one of our medical plans, you will have access to our telemedicine service called Teladoc. Teladoc allows you to have a virtual visit by phone or video with a licensed physician at any time from anywhere. Through Teladoc, you will discuss your symptoms, and the doctor can diagnose and treat a wide range of non-emergency medical conditions and even call in a prescription. Teladoc is especially convenient for those times you are unable to leave work, you are traveling out of town, or your primary care doctor does not have any openings. Teladoc also allows you to contact a mental health professional as part of the Teladoc benefit. There is no cost for a Teladoc consult if you enroll in the PPO plan, and $45 per primary care consult if you are enrolled in our HSA plan. Please see the cost structure of the mental health professional consults for the HSA plan in the benefits guide. Our dental insurance carrier is Guardian. Guardian maintains one of the largest networks of dentists throughout the areas in which employees of Greenway Automotive live and work. Our plans cover services received from network and non-network dentists. By utilizing network providers, you will receive the highest level of benefit and save on out-of-pocket costs. Charges from out-of-network providers are higher than the negotiated fees charged by network dentists, and non-network dentists may balance bill you for the amounts not paid by Guardian. For this reason, we encourage you to use network providers as much as possible. We offer a dual option dental plan, and you have the choice between the high plan and the low plan. When using a network dentist, both plans cover preventive services at 100%. Under the high plan, after the annual deductible, in-network basic services are covered at 100% and major services at 60%. Orthodontia is covered for children to age 19 at 60% in-network and 50% out-of-network to a maximum benefit payable of $1,500 under the high plan only. Under the low plan, after the annual deductible, in-network basic services are covered at 80% and major services at 50%. Both plans have an in-network deductible of $50 per person to a maximum of $150 per family. The deductible is waived for preventive services in the high plan and only waived in-network in the low plan. The high plan provides an in-network calendar year maximum of $1,500, while the low plan has a calendar year maximum benefit of $1,250. The high dental plan includes Guardian's maximum rollover benefit. Under this arrangement, if you go to the dentist at least once during the year and your claims do not exceed $500, then Guardian will add $250 to your annual maximum benefit if you see a non-network dentist and $350 if you see a network dentist. You may continue to roll over benefits until an additional $1,000 is added to your maximum rollover account to be used in future years. Guardian also has a college tuition benefit with select participating schools nationwide. With the college tuition benefit, you earn annual tuition rewards for every year you are a Guardian Dental member. You must go online and register to begin earning your rewards. More details are provided in your benefits guide. Our vision plan with Guardian provides exceptional benefits at an affordable cost. The plan utilizes the Davis Vision network of providers. If you use a network provider, you will pay $10 copay for routine vision exam every calendar year. Most lenses are available for a $15 copay every calendar year. Once every other year, you can purchase frames. If you choose contact lenses in lieu of glasses, the plan will cover the cost up to a $150 allowance, plus an additional 20% discount on the amount over $150 at various locations. Guardian's member website is called Guardian Anytime and provides convenient online access to your benefits. By logging in at guardiananytime.com, you may review your benefits, check the status of a claim, and download copies of your explanation of benefits, find network providers, and even print a new ID card. Greenway Automotive offers all benefit-eligible employees the opportunity to purchase disability insurance through Guardian, which protects your income in the event an accident or illness prevents you from working. The short-term disability insurance provides 60% of your weekly income not to exceed $1,500 per week, and benefit payment begins on the 8th day of disability. The benefit will continue to be paid while you are disabled for up to 180 days to coordinate with the long-term disability insurance. The short-term disability plan does not cover work-related accidents or injuries, but it does cover approved leaves due to maternity. Benefits are limited to 2 weeks for disabilities arising due to a pre-existing condition in the first 12 months of coverage. If you are a newly hired employee, you can elect disability coverage without having to answer medical questions. The coverage is guaranteed. If you waive voluntary short-term disability when you are initially eligible, you will be required to complete a medical questionnaire called an evidence of insurability if you enroll at a later date. If you are still disabled and unable to work at the end of 180 calendar days, our long-term disability insurance will begin to provide 60% of your monthly earnings to a maximum benefit of $5,000 per month. There is a pre-existing condition limitation on the long-term disability. Any condition that existed in the 3 months prior to your coverage effective date will not be covered until you have been covered under the plan for 12 months. If you are a newly hired employee, you can elect disability coverage without having to answer medical questions. The coverage is guaranteed. If you waive voluntary long-term disability when you are initially eligible, you will be required to complete a medical questionnaire called an evidence of insurability if you enroll at a later date. You may purchase supplemental life insurance for very low group rates on yourself in $10,000 increments to a maximum of $500,000. You may purchase life insurance in $5,000 increments on your spouse, not to exceed 50% of the amount you elect on yourself, or $250,000, whichever is less. And you may purchase $5,000 or $10,000 of coverage on your dependent children. If you are a newly hired employee, this is a valuable guarantee issue opportunity for this coverage. You can purchase up to $150,000 for yourself, up to $50,000 for your spouse, and up to $10,000 on your children without having to answer any medical questions. If you elect coverage in an amount over the guarantee issue amounts, you will need to fill out an evidence of insurability form for the excess amounts and go through an approval process with Guardian. If you waive supplemental life insurance when you are initially eligible and you enroll at a later date, you will be required to complete an evidence of insurability for approval by Guardian. We offer voluntary accident, voluntary critical illness, and voluntary hospital indemnity plans with Guardian. Our accident plan helps you pay for expenses associated with an accident, such as deductibles, coinsurance, and copays. Listed here are just a few of the benefits our accident plan provides. You can cover yourself and your dependents. Our critical illness insurance pays a lump sum benefit upon diagnosis of a critical illness or condition. You may elect coverage in the amount of $5,000, $10,000, $15,000, or $20,000. Please be aware that there is a pre-existing condition limitation when electing critical illness. A pre-existing condition includes any condition for which you consulted a physician, received treatment, or took prescribed medications in the 3 months prior to your effective date. Such conditions are not covered until you have been covered under the plan for 12 months. For complete details, please refer to the Benefits Guide and Guardian Certificate of Coverage. If you are a new hire, all amounts are guarantee issue only during your initial eligibility period. If you did not elect critical illness when you were initially eligible, you will be required to answer a series of medical questions on the basis of which coverage may be denied. Our hospital indemnity plan pays a per-admission benefit along with a daily benefit if you have a covered stay in a hospital or ICU. Benefits are paid directly to you and may be used to pay for medical expenses, such as copays and deductible, or for non-medical expenses, such as travel and child care. You choose how to spend the money. There are 2 plan options to choose from. Plan Option 1 pays a $1,000 per hospital admission benefit and a $2,000 per ICU admission benefit. Plan Option 2 pays a $2,500 per hospital admission benefit and a $5,000 per ICU admission benefit. Both plans also pay $100 per day for hospital confinements and $200 per day for ICU confinements, to a maximum of 31 days per year per insured. There is a pre-existing condition limitation on the hospital indemnity plan. Our Employee Assistance Program is offered by Guardian. Our EAP program is a comprehensive resource designed to provide support in many areas of your everyday life. From emotional issues to financial concerns, or from daycare to legal advice, our EAP provides toll-free support through master-level counselors. Call or log in to Work Life Matters today. We are proud to present this benefits package to our employees. Now it is time for you to take action. Be sure to review the Benefits Guide and complete your benefits enrollment online through PlanSource, even if you are waiving all coverages. If you are a newly hired employee and do not complete your enrollment prior to the end of the enrollment period, you will be automatically enrolled into the medical plan with single coverage, and the cost will be deducted from your pay. If this is your annual open enrollment, you'll need to complete your benefits enrollment online, even if you are not making any changes to your elections. Remember to use the tools available to you from Blue Cross Blue Shield of Florida and Guardian. Utilize in-network providers for our health, dental, and vision insurance plans to maximize your benefits. If you are electing one of our medical plans, remember to take advantage of Teladoc and ask for generic medications when possible. Remember to take care of yourself. If you exercise, eat right, manage your stress, and don't smoke, you can greatly reduce the chances of developing health problems. Let us know if you have any questions, and thank you for your time.